Hi, I'm Dr. Prakrutha, Fertility and IVF Consultant at Aster CMI Hospital, Bangalore. March being the Endometriosis Awareness Month, we will discuss about endometriosis and infertility treatment options available for people who are planning to conceive suffering from endometriosis. Right? So we all know endometriosis is a very debilitating condition. It's a very progressive inflammatory disease which causes a lot of pain in women, mostly during their reproductive age group, right? Having painful periods, painful sexual intercourse, one of the symptoms. How does it impact fertility? Endometriosis affects the egg quality. Endometriosis affects the egg and the embryo mobility in the fallopian tube. So the fallopian tube may also be diseased because of endometriosis. This affects the natural conception possibilities and probabilities. So what do women who are planning for a conception suffering with endometriosis should basically know about? They should be aware that there is a certain time frame within which conception should occur. In case if they are planning to postpone their conception, it is very important to undergo fertility preservation. Now, what is fertility preservation? So we might have very well frequently heard about social egg freezing, where a woman doesn't want to conceive much early in her life because of her career goals, etc. reasons, because of which she wants to preserve her eggs or embryos and conceive at a later point of time. So this is for a social cause. Fertility preservation in cases of a particular disease, maybe it may be because of an onco, or such as a couple is or a patient is suffering because of a cancer, or it's because of endometriosis. So endometriosis does affect the quality. Overall, it impacts the ovarian reserve as well. So ovarian endometriosis specifically, basically they are the chocolate cysts that are formed in the ovary. These also have an impact on the surrounding healthy follicles. So this has an impact on the future ovarian reserve, hence the need for fertility preservation. So preserve your eggs as early as possible, so that at a later point of time you shouldn't look back and say, oh, I should have got it done at that point of time. Oh, I could have gone through another higher procedure, maybe an assisted conception method, maybe an IUR or an IVF at that point of time, rather than going for other options at a later point in time. Infertility and endometriosis together running in parallel can add to the severity of the disease and exaggerate the condition and have more issues later in life. So very important that the disease is diagnosed and you have a follow-up and you have a treatment plan as to how to go about with conception. So there are mild diseases where endometriosis level 1 or stage 1, stage 2, where your tubal factor is healthy, your tubes are good, the male factor is healthy, maybe with help of medications or with help of an IUI or an assisted conception, the couple can conceive. But for severe diseases, stage 3, stage 4 endometriosis, where the ovarian reserve is affected, the tubes are affected, if there is any add-on factors such as a poor male factor and things like that. So it's always necessary that you discuss with your doctor and go about with what the best treatment may be. It may be an IVF. Yes, for stage 4 diseases we do recommend an IVF, more so because it is more sure shot that we are able to obtain an egg out and form an embryo and preserve it for you. Or you want to go ahead with an embryo transfer then and there, yes, you can go ahead. So this has definitely higher success rates and higher chances of achieving a conception in stage 4 diseases compared to other treatment modalities. IVF is usually recommended treatment for women suffering with stage 4 diseases. There is also other options discussed. Maybe your doctor may counsel for a third party reproduction. So this happens when your ovarian reserve is too low or where there is no chance of obtaining a mature egg from your own ovary. This again has to be a thorough counsel discussion as a couple with your doctor. So in case if you are not married, you are planning for a conception later, you have been diagnosed with endometriosis, you have already undergone a few laparoscopic procedures because of endometriosis, it may be related to your ureter or your bladder, be aware that fertility preservation is a very important option to choose upon. Discuss it with your doctor and go about with it. So how do we diagnose endometriosis? Endometriosis has its own symptoms, of course. Like we discussed, it may be painful periods, it may be painful sexual intercourse, painful passing of urine, or painful passing of stools. So there's this chronic pain that is always associated. When you meet your doctor, the doctor may just prescribe you some symptomatic medications. But what are the diagnostic modalities? So usually the most basic underlying modality we do is an ultrasound. Many a times ultrasound does pick up endometriosis, such as endometriotic cysts. Yes, ovarian endometriosis is something that is easily picked up by a transvaginal good ultrasound, right? But despite an ultrasound telling that there is no such endometriosis or no such thing called as an ovarian cyst, which may likely be of endometriosis, the patient still may be suffering from endometriosis. So the baseline modality, though ultrasound is, we have higher modalities which may be an MRI. Of course, the laparoscopy or the keyhole surgery, what we call, is the most and the best effective tool to diagnose endometriosis. It is highly recommended because it is not only a diagnostic modality, also it becomes a therapeutic modality. So you see an endometriosis, you treat it then and there. You do undergo the laparoscopic procedure for the diagnosis for chronic pain. You see that there is an ovarian cyst, considering all other factors that you are involved in based on your age, your parity, that is the number of children you have or you are planning to conceive. So all these factors to be individualized, and then a treatment protocol can be set upon. So laparoscopy is very that comes in handy to us as clinicians, as doctors, to see and treat the disease. Does it recur? So you had a cyst, the cyst was removed. Does it recur? Yes, it does recur. So what are the chances of recurrence? Over a period of time, it is noted that a complete cyst excision is much better than just cyst aspiration. So this is something that you can discuss with your doctor. But many women who are planning for fertility or who are planning for childbearing, the treatment modality may be slightly deviated. So there are many multitude of conservative drugs that have come up in the market, which are given for endometriosis, for pain relief, as well as for ablation of the disease. So to decrease the severity of the disease, there are multitude of hormonal medications, injections that have been given. Now all these are not suitable when you're planning for a childbearing, right? So this has to be discussed one-to-one, and an individualized protocol be set so that the pregnancy is achieved at a higher rate. There is also a consensus that women with endometriosis also end up with higher number of fertility treatments. Is that true? Yes, it is true, because endometriosis causes difficulty in achieving a conception. Not in all women though. There have been multitude of people who conceive normally. There are other factors such as the age, the male factor, the partner's parameters, like the tubal factor. So endometriosis mainly affects the quality of the egg. It also can affect the tubal penetration. So if there are clots, if there is tubal endometriosis, definitely it can affect the natural process of conception. Overall, endometriosis is mostly a disease of your reproductive age group. So does it stop after menopause? Yes, most likely it stops after menopause, because it's a hormone dependent disease. It's estrogen derived. Post menopause, the estrogen levels in the body decrease, and the women, the severity of the disease decreases. So do all women attain a completely disease free course after menopause? Mostly all, but not all. So there might be some amount of chronic pain. Say for example, if there's a hematosalpinx, that is basically a blood clot within the tube. So even after menopause, this may cause a chronic pain in the woman. So this is just an example or an instance that I spoke of. But it is very important that as a patient who has been diagnosed with endometriosis, you need to be on a constant follow-up with your doctor and see whether the disease is progressing or regressing. Disease may regress, it may remain status quo, or it may progress. So always have a constant follow-up. That is very important. For any further queries or any further discussions, do contact the IVF department at Aster CMI. Thank you.